This is WCNY's The Capitol Press Room, and we're exploring a campaign to boost access to primary care in New York. And our guest is Assembly Health Committee Chair Amy Paulin, a Westchester County Democrat who carries legislation designed to emphasize primary care services in the state's health care delivery system. Well, for starters, Assemblymember, is there data out there, or maybe it's just a collection of anecdotes that suggest people aren't utilizing primary care services enough in New York?
There's no question that, when people feel well, especially younger people, they don't go to doctors. And as you get older, you more typically go to an individual doctor for a health care issue that you might have. So what primary care does is it looks at the whole person and makes sure that that little pain you might have, you talk about. Mm-hmm. That the monitoring of your heart is every year instead of when you're feeling palpitations. So it's very important that we get people in the habit young, that they go often, they go yearly like they should, and we have enough providers in the system to accommodate that.
And is it the case that people aren't seeing primary care providers at the rates they should because there are not enough providers in parts of the state? Or is this primarily a cost issue? Because a visit, if you're going to order labs, for example, depending on what your insurance is like, could cost you a few $100.
I think it's much more that that there's not enough providers, okay, and people aren't getting appointments quickly. I just mentioned at the press conference, for example, that, for me to get an appointment with my primary care provider, I have to think a year in advance because she's so booked up.
You don't go, hey, it's Assembly Health Committee Chair Amy Paulin. Wouldn't you like to maybe get some member items in the future or anything like that?
No, I don't.
Okay. That's a free idea for the future.
I'll think about it.
Okay.
But in the meantime, the other system that I do use is making a phone call to the secretary of the healthcare facility, or sure, the assistant who's taking that input. And, and I try to get on the calendar. And then if I need to change it because of session, I have a lot of difficulty. So I try to avoid it. I try to think about it because I know that those appointments are so hard to get. You can often go on a cancellation list, something I did last year because of session. So, but they're hard to get. And the reason they're hard to get is because not enough resources are put into them. Doctors need to be reimbursed better if they're doing something as important as wellness care. So they need to be valued more. And that's what the bill is really trying to do, to tell the insurance companies we need to value primary care doctors over and above specialties, or at least almost equal to specialties.
So does that mean just increasing reimbursement rates, or is it more complicated than that with your bill?
I think that it's really, we're leaving it up to the system just to a large degree. But it could be as simple as reimbursement rates. But I would also argue that, we've trended toward managed care, especially for Medicaid patients. Sure. But, generally, a lot of people are in that kind of system. And managed care is supposed to manage care. And one of the ways that we have always said they should manage care is to encourage a wellness care. And which is what a primary doctor does. What a primary doctor does is they catch ailments prior to them escalating to something more expensive. So we should be putting more resources in. And if we did, doctors would be encouraged to go into to that kind of field.
So is there any sort of records or databases out there that indicate that private insurers aren't spending money on the primary care sector the way they are some of these specialized fields? Is there any sort of database that's out there of claims that's analyzing this information? Or is this kind of a black box with some of the tools that might be utilized, like an all-payer database, not actually coming to fruition and being accessible to people?
I think that information is private, so we don't know. But one of the things that the bill calls for is that transparency.
And is that something where there should be more transparency? Is the opaqueness something that people have tried to address for years now, this idea of an all-payer database to get a better sense of this, and just maybe state health officials haven't gotten the ball rolling on it?
I think the transparency is going to help a lot.
Mm-hmm.
And, why it hasn't happened, I don't know, but that's why it's in our bill.
Sure. And in terms of that connection of rates and incentivizing people to enter this space so you can have appointments so you don't have to book a year out or whatever, is there an expectation that we need to grow beyond just turning to medical doctors for our primary care services? Should other healthcare providers play a larger role in our primary care system?
Well, primary care does not have to be done simply by doctors.
Sure.
It could be done by nurse practitioners, and the system allows for that and would credit that toward that money goal. So I think we often see nurse practitioners as someone's primary care doctor, or we see a physician assistant as someone's primary care doctor. Those things could all happen as well.
Well, then let's talk about that second component there that mentioned the PAs. There's an effort to give them greater autonomy as part of the budget. Is that something that you think needs to go hand in hand with something like this?
I think that people are looking at the doctor shortages out there
Mm-hmm.
and they're thinking of different things. That's certainly one of them. I carry a bill that does that exact same thing. How much appetite there is, we'll see if it's in the final budget or not, but it is something that I do think could help the system.
And thinking about the system, though, what we've seen in some areas when you change rates, you see people just continue to go in those areas where people want to live and work, like a more urban area or suburban area where they can pay more. Is there any reason to think that your bill is going to solve the problems of rural areas, or is it just going to mean even more doctors and primary care providers in those suburban and urban areas?
I would say the transparency is going to help us a lot because then we know where to concentrate our efforts. If, for example, as you might be implying, that maybe the problem is all in the rural areas.
Mm-hmm.
Maybe the problem is all in the urban areas. We don't really know, right? So once we find that out and we see where the dollars are not being spent, we'll know whether there's something else we have to do. Maybe it's more complicated, as you suggest, but we don't know that until at least we try this.
And does the legislature have tools that it can utilize once you do get a better sense of the landscape? Can you mandate certain rates in the private market? I mean, what are the tools that you can use?
There's lots of tools, lots of laws we could do. And we haven't thought about them all because we don't know what all the problems are. So I want to go back to identifying the problems, where they're located, and then speaking to the people in those areas to figure out what are the next steps.
And you held up the primary care visits as an important cost-saving measure as a way of, say, early detection in some examples. But is there reason to have that much faith in primary care visits? I think some people feel like you're just going through an assembly line and they're just there to run through as many patients, and they're not necessarily asking you the right questions or spending the right amount of time with you. So what, if anything, would this bill do to improve that concern that people have?
I think that concern is from people who aren't going. If once you find an internist or primary care doctor that you like and you develop a relationship and they know you and they know your body and they know what to look for, I think that those relationships with providers are happening all over the place.
So you feel like there aren't some who are treating this like a factory operation where you're doing a volume game?
Maybe. It's just not my personal experience.
Okay. Well, we've been speaking with Assembly Health Committee Chair Amy Paulin. Assembly member, thank you so much for making the time. I really appreciate it.
Thank you.
Support for Capitol Press Room comes from National Fuel, working to help customers understand what drives energy bills, from taxes and state-mandated programs to market-driven price increases for natural gas, which utilities don't profit from. More information at betterplansnobands.com.
And by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.